how big of an issue is fear and anxiety in the world of dentistry?
It's a huge issue. In fact, I think it keeps a lot of people from coming to the dentist. And one of our, Joe, and our purpose today is really to allay those fears, because he and I have pioneered gentle treatments using lasers and pinhole surgery, so that the procedures we use now cause almost no postoperative pain, and they're, with our sedation, there's no pain. You don't remember most of it, and most people, the vast majority of people, say, "Why was I afraid?" So, really, when we say this, there's nothing to fear. Really, there's nothing to fear now.
I have to agree with Tom. I mean, we have, our patients experience really virtually no pain unless there is some unusual situation. And one of the things, and we use IV sedation very routinely. And when I tell the patients, you know, you're probably going to be asleep during the treatment, there's and they're relieved, you know, they're very glad to hear that. They don't really want to sit through that. And you know, why do people stay away from the dentist? Fear and anxiety. Well, what's the fear and anxiety about? The fear and anxiety is about pain. They're afraid they're going to have pain, which they may have had previously, particularly if it happened when they were a child. Those things stay with them. So in our offices, and Tom and mine, pain has become pretty close in most of the cases to non-existence, really. The procedures that he and I do are minimally invasive, truly minimally invasive. And when you're doing a minimally invasive procedure, particularly when the patient's relaxed, sleeping, there isn't certainly not pain during the course of the treatment because they're anesthetized. What we do is we give them sedation, they're falling asleep, then we use local anesthetic, do the procedure, and then when they come out of it, they're all set, they're ready to go, and there's very little discomfort afterward. I never prescribe opiates. I just don't do it anymore. It's never necessary for the kinds of procedures that I do. So after an experience at Tom's office or my office, generally these patients, their fear of going to the dentist, their anxiety and fear is usually diminished. And I'm happy to be able to accomplish that.
Yeah, it's really a miracle nowadays that we see people who come in routinely with tremendous amount of fear. And one, as they get to know us and the gentle team and the gentle way we are, and then when they see how it works out, their fear literally disappears in like 98% of the time. It's amazing.
Well,
So,
actually,
yeah, go ahead, Dr.
it disappears in 100% of the time once they have the IV sedation going through their body.
Exactly.
It may recur at a future date, but the IV sedation, you know, I tell patients, I said, you know, in about 1 minute, and these patients are anxious and tense, I said, you know, even if you want to be anxious and you want to be tense, you can try as hard as you want to. But once this sedation takes effect, you're not going to have a choice. You're not going to be able to be anxious or tense or afraid or worried because it does the job, and you can't really, you really aren't going to be able to fight it, and you're just going to be really, really comfortable.